I think what this space allows us to do is really be innovative and to enable us to centralize everything in one location, further eliminating those barriers to care for our patients. So we have medical, dental, wellness, nutrition, counseling, all under one roof, as well as brain health. So it's very exciting times to be innovative and to also be in the neighborhood that we really truly need to be in to get the most out of our investment in this space for our patient base.
So it sounds like a big part of this is trying to remove barriers, improve access. Why is that so important when you're working with a client base that is primarily lower income?
Sure, because one of the largest barriers to care and the biggest reason it's important to be where the patients are is because unlike many individuals who can just jump in a car or their truck and go to wherever they need to go, our patients maybe don't have as reliable a transportation. So it's really critical to be where they are to better enable them to use the services and encourage them to use the services that are available. So being in this part of town, literally across the street from our old clinic, which we knew was quite successful, was really encouraging to just be able to remain in the same neighborhood.
What was kind of the thought process behind trying to expand into this new space?
Well, after a successful 10 years or 9 years over at the original space, when the board did our strategic planning, we realized, and based on staff input, that we were running out of space and our patient wait time for appointments was becoming unrealistically long. And with the projections from the federal government and our local area, we knew we needed more space to house more dentists, more doctors, more nurses, etc. So that was part of our strategic planning, and then we began to look for space and have a facility planning process, which actually took about 2 years to figure out what the needs were, where we could potentially go, and then design the space, and then work out all the logistics. And then we began the construction with the developer here at the MedX building. So it's been a long process, but a very thoughtful process, engaging process with community members and staff with a lot of input in order to meet the current and future needs of the patients. So there'll be a lot of room for growth here, and flexibility and creativity in how we serve our patients.